welcome. I was intrigued by our next story. Why would someone transport a medical team to remote areas of the world to provide life-saving care? Dr. John Sherman has dedicated his life to bringing medical care and the Word of God to desperate people around the world. Welcome, Dr. Sherman.
Thank you. It's good to be here.
Yeah. Well, you have quite an interesting story. You have a medical practice that you manage on a normal basis, and then you are very frequently flying off with a team of people to some remote part of the world to...
Yes, we've been doing this for quite a while now.
Yeah. How many years, the name of your ministry is CHIA, is that right?
Christian Hands in Action, or CHIA is the acronym.
Right, And so how did you get started in this?
Well, of course, this is a long story, but the shortened version is that after I got out of the Army, we started delivering health care on a secular basis to the Hudspeth County and area in Sierra Blanca. And we just every Thursday would take a group of doctors and dentists and whatever out and deliver care to everybody in the area. And then my wife and I, due to a lifestyle that included a lot of traveling, started flying our own plane in the early part of the 70s. And since I like to hunt and fish in Mexico, some of my friends down there thought it'd be a good idea to come down and see patients at their ranches. And so throughout the 70s, we would traipse into that part of the world and see patients at these ranches and mines and all. And then in 1980, our pastor at the time was Reverend Brooks at Western Hills Methodist Church, was at dinner with us, and he wanted to get the church involved in hands-on missions. And he knew we had spots that we'd been working. There was no ministry to it, but he wanted to start a mission. And as they say, the rest is history. From that point, we kind of swamped their work area on missions and went out and became an independent ministry, 501c3, and then from then on, we just the ministry expanded over the next 30 years.
Now, you just recently took a trip to Uganda. What was that trip like, and how long do you stay there, and how many people do you serve?
This trip was in March. We went with a ministry out of Dallas. We are what we call mission brokers, and in this case, this ministry in Dallas was working in Kampala and in the Rakai district, which is down on the Uganda border. And they've been doing a lot of work in terms of children's ministries, preaching and teaching on a number of times, but they wanted to get involved in medical dental and possibly optometric. And so they contacted us and asked if we would put together the medical team. And in a year and a half, we went down on the first time, and we returned again in March and took a team, a total of 30-some people, including teenagers from Prestonwood Baptist Church in Dallas, as well as a number of adults. And we went down there, and in the course of the 10 days that we were gone, we saw over, I guess it came out around 2,700 patients.
Wow, 2,700 patients.
It was a very large group. We had an AIDS testing and malaria testing going right on with the medical work. We involved a number of the local doctors that worked with us. We had a couple of physicians and a couple of nurse practitioners, as well as nurses and lab techs and these people. And so it was a very large outreach.
Right. Now, the people who would be on the team from the U.S. would be medical professionals as well as just lay people. Is that right? Or?
Well, in the way we set things up, we have to have your medical professional. You've got to have, of course, your doctors, and it helps to have some nurses and all. But the system that we've worked out over the years with CHIA is one that is adaptable, really, to use lay personnel. It's very user-friendly, is the current terminology. And both the system that we use for medications as well as the format for running the clinic. And in the case of Uganda, it was extremely important. In fact, as we arrived at our first site out in the jungle, I turned to my wife, Susie, and said, this is going to be a very difficult trip, because we had over 500 people waiting to be seen. And But the Lord's good, and He looked after us, and we all managed to survive it. But it was a great trip, and we had, in the course of the week, we had over 200 decisions for Christ, which in itself, of course, is the reason we're there.
Right. Now, you said that it's kind of user-friendly, so to speak. So you have eliminated everything that isn't, where it's not medically necessary to have a doctor or a nurse doing something, or what kind of roles can people play in a mission like that?
Well, for instance, in the pharmacy, of course, you have to take along your medications. Well, we prepare all the medications ahead of time right here in our office here in El Paso. And the medications are all put into prescription packets with instructions on them. And we know from our experience about how many of each thing, antibiotics, vitamins, worm medication, et cetera, we need for any given clinic. And we have what we call a 200 patient unit, and that's about what we see on our really short trips. Now for this one, I figured I needed 4 units. As it turned out, I need about 6 because the numbers were way more than what we expected. But the bottom line is that when we get there, we could take somebody like yourself and then pretty much in 5 minutes make you the pharmacist, because all you have to do is be able to read numbers. And our clinical sheets that we use, and the local doctors can use them as well as ourselves, and they are able to write in by numbers, 100, 200, 300, for instance, for decongestants, antibiotics, stuff. You look at them. If you're the pharmacist, you may not know what ampicillin is, but you see the number 300, and you know that's the one that goes to them. So it's a system we've been using for 30 years, tweaking it a little bit as time goes on, but extremely good, and it's very accurate, really. The errors over the years.
Probably better than our own pharmacies.
Well, I see fewer errors in our clinic than I might here at home, but that's another topic.
Yeah.
But we do things like that, and we've figured out various mechanisms for approaching a group, so that when you see something like 500 people waiting in a crowd,
what do you do?
We're able to go at it. And of course, it's helpful to have team members. In this case, my wife, who is an RN and ran the pharmacy, she's able to explain it to the people and get her part working. And we have a format of doing it that gets the clinic, and in 30, 40 minutes, everybody knows what they're doing.
And does it.
On we go.
Yeah. Now, if this system has been duplicated by other ministries and other organizations, right?
It's open. There have been some that have duplicated. I know, in fact, this trip, the local pastor / nurse practitioner, that he and his wife have a clinic, woman and children's clinic there in Kampala, and some doctors were working with us. Well, they saw the system and literally fell in love with it, and I said, go ahead and use it. It's there to be copied free of charge, obviously. Right. And we left all of the medication we had left over with them, and they took them. And I got an email not long afterwards that thanks to the system that you set up here, we've been able to over double the patients we're able to see in our clinic. Yeah.
Well, that's wonderful.
It's very efficient, and it's really a system that we've presented to not only in the ministry field, but it's also a system that is clonable for third world health care. And we talked to governments in Chihuahua, and of course down in Acapulco and South America, a number of places. We presented the system as a way of low-cost way of getting health care to their poor people.
Right. Now, you said that during your Uganda outreach you had 200 decisions for Christ. So how do you combine the medical component with the evangelism component? How does that happen?
Well, of course, the medical and the dental trip brings in the people. I mean, the people come in and out. Of course, you're looking to bring in people that aren't churched in the area. Yeah. We have, of course, working right with us, our local pastors. In the case of Uganda, we had half a dozen pastors who are right there with us. So as the people came in and are waiting to see the doctor, the pastors in turn are talking to the people. We had one gentleman, Santiago Gomez, who's from El Paso, and he was with us on this trip. and he has a real heart for the Lord, and he was over in one corner, and everybody that came through that he was praying with. And so as we're doing the treating in the medical, the dental, the optometric, the pastors are doing the evangelizing.
And is there any problem with that with the government officials or anybody?
No.
How do they feel about that?
No problem at all. We've worked in I don't know how many, 30 different countries, I guess 20. I don't know. It's been many countries over the 40 years we've been doing this, and really we've not had any opposition at all from the governments.
Isn't that unusual though? Don't people usually have to kind of keep a low profile? How do you manage that compared to?
Well, I guess the Lord works in wondrous ways. As I stated early in the interview, we started out in Mexico with people working on a secular basis with ranchers and people that were, shall we say, the upper echelon of the society. As a result of our interaction with these people over the years, we've had really very good connections in the higher government, higher parts of the government, and they know that we're down there working to help the people. And but this backup has been most useful because there are always pitfalls in third world ministry, and we really have been blessed immensely over the years by very, very good governmental support.
Well, when you go into an area, I guess you've learned over time to work with ministry partners, right? Local ministry partners, whether it's pastors or health clinics or whatever, and then also to make those contacts with local officials and that sort of thing. Is that pretty much standard operating procedure for you, if possible? Or
it varies from one place to another. It just really kind of depends upon where we are and what the current situation is. Some places will work where we have absolutely no contact at all with any local officials. Other parts that we might work, certainly in Latin America, where we've done an immense amount of work, there'll be some places where we know the local officials, and if we'll invite them to come on out to the clinic, and not infrequently we have family members that come out to be treated, and of course this has opened many avenues for evangelism of the leaders of the area. And there are a ton of stories that we can tell of conversions, people that have come to Christ that were in leadership positions in various counties, states, wherever. A lot of very exciting tales, in fact.
Well, can you tell us one of them?
Well, probably the one that comes immediately to mind, we ran a mission out to the island prison of Islas Marias in Mexico. Now, Islas Marias, for those who don't know, is a prison guarded out in the middle of the ocean, guarded by sharks. And it was known to be one of the nastiest prisons probably worldwide, and just was a very bad place. And the warden of that particular prison, he's kind of a mean guy. I mean, he's not the type of person you'd like to sit down and have dinner with, shall we say. And we were down there doing a lot of surgeries. We did close to 200 surgeries there over a period of a couple of years. And in the course of it, got to know the warden pretty well and had dinner with him since we were visiting. Well, he was courteous and had us at his house for dinner. David Rico, who was one of our staff people from here in town, I had been talking to him about Christ off and on during the course of our visits. And this guy, when I last saw him, you just took one look at his face, and this guy's mean. I mean, you knew he was really mean guy.
Trapped on an island with sharks circling you, I think.
Yeah, with the worst criminals that they have in the country.
Right.
Well, about 3 years later, he had been gone, and David said to me, "John, we got to go to Mexico, Mexico City," and we went down there because we had something to do. And he says, "We have to meet. Remember Warden so and so?" I said, "Yeah, I remember Warden." So he says, "Well, he wants to see us." And I said, "Really?" And he said, "No, we got to see him." Well, we met at a restaurant. He came in, and I looked, and I still can see his face had totally changed. And he had accepted Christ thanks to David's ministry. He came back to Mexico City. Of course, when you survive that island prison in those days, you were right up in the hierarchy of the prison system. And he proceeded to spend the next hour telling us the stories of the Bible studies going on inside their offices there of the Christian schools that he and others were starting in Mexico City. And this all came directly as a result of being down there doing surgeries.
That's very exciting.
It really was.
Really amazing. So the purpose isn't just medical. It really, the primary purpose really is to evangelize, to change lives, and so forth, right?
Oh, definitely. The medicine is nothing more than a tool.
Right.
It brings the people in, and it's then up to the local pastors and all to use this contact that they might not otherwise have gotten if it hadn't been people who wanted to get a tooth pulled or filled.
Right.
Or belly fixed or whatever.
Yeah. Now, you do dentistry also, and you have some portable dentistry equipment and that. I mean, how do you do that? You can't take a...
We have full dental, portable dental units. They're field units. A lot of them are developed out of the military. And so we go in with generators and, of course, compressors and all the things you need to run these drills. In fact, we're getting ready. We've had them for 15 years. We're getting ready to have to replace our units and update them, and we're taking the older units to Dallas here in a couple weeks, getting them refurbished, and then we're going to, when we go to Uganda again in August, because we decided to go back, we're going to August, and we're going to take in those dental units and set a clinic up there in this Women's and Children's Hospital and get them trained on how to take care of the equipment.
Well, that's definitely exciting. That's going to open up a whole new avenue for them. Now, you mentioned Chihuahua, and you had kind of a unique experience with the government officials and flying into Chihuahua with a bunch of equipment and so forth, and people being afraid that it was either going to be confiscated or you were going to have to pay mordida.
Yeah, that's well, these contacts that we developed down there, of course, were very helpful, and one of them was an individual who's very high up in the customs department, and anybody who lived here on the border and knows anything about well, probably any country, but certainly Mexico, the higher customs officials are somewhat influential, to say the least, for a number of reasons. And we had done something a little different there in Chihuahua. We'd gone out to the Sisogichi, which was the bishop's, the Catholic bishop's favorite hospital and their mission. And we'd taken in a lot of supplies. In fact, I flew out there, and the nun gave me a want list, and we came back and filled all the things that she needed and flew them back in. And of course, being an evangelical ministry in Latin America, a lot of times there's at the very least some conflict with the Catholic Church, and there can be. And as I told the sister, we're not here to compete with you. We're serving the same Lord. We may have some differences in theology, but we'll give you a hand. If you're helping the people, we'll help them through you. Well, later on, this custom official in Chihuahua called me into his office when I landed, and he said, "Dr. Sherman, I see you're helping Bishop so-and-so." And I said, "Yeah, we're giving him a hand." And he says, "Well," he says, "there are lots of ways you help Bishop so-and-so, who's my very, very close friend." He says, "a lot of ways we can help you." And so I know, Comandante, that is quite possible. And later on, we had 3 airplanes loaded with, basically contraband. There were computers and all that we were taking into Wycliffe Bible translators to help them finish translating the Bible into, I think it was Tarahumara there. And we landed, and one of them was flown by one of the missionaries out of there, and he said, "John, you look at our airplanes, they're loaded with computer stuff, they're going to take our planes from us." And then the Commandante and his entourage were coming across the tarmac. He said, "We're in trouble, it's so-and-so." I said, "Well, you have little faith." And the Commandante comes up and he puts his arm around and he says, everybody says, this is Dr. Sherman. He's a friend of Mexico. He said, don't ever give him any trouble. He said, come on in and have a cup of coffee. And we walked back. Of course, they never looked at the plane. And my friend was just stood there with his mouth dropped open. And later on, we heard they said, I think we realized why chia gets quite a bit of support.
Right, yeah. That's exciting how that works. Now, what are some of the most common types of things that you treat when you go? Is there
the aches and pains? It varies a little bit depending upon where. If you're down in the jungles, for instance, in Central America, why we see you see a lot of parasites every place, but in the jungles, I see a lot of skin infections. Of course, colds and sore throats, they get them there just like we do. In the higher mountains, we see a lot of high blood pressure. See some TB in the areas,
so one of the biggest challenges is worms or parasites, right? If you treat one person, that doesn't work, right? You have to treat the whole village. Is that right?
Everybody comes through in all of our clinics, be it Africa or Central South America. Everybody comes in, we worm them.
Really?
We give them all worm medication. And we've learned over the years, because we've kept records of this, and it would seem that the belly aches and the fatigue and everything that go along with the parasitic infection tend to go away very quickly. But about 4 to 6 months after worming, symptoms start recurring. So we figure about every 6 months to 8 months, we like to worm as many people as come through the clinic.
Right. Now, one of the things that you began to look at was what were the causes of so many of the illnesses, and it was impure water, right?
Water,
yeah.
Water, and water.
So they're just drinking from wherever, and that gives them all kinds of things. And
I was walking down a canyon, and a Tarahumara Indian was up here down by Creel in the Copper Canyon country. And we were walking down this canyon to kind of sightsee a little bit, and the Indian guy says, yeah, let's get a drink. And he goes down. I said, where are you going to drink? And he goes down to the creek. Well, the creek looked like something that might have come out of your dishwasher.
oh, wow.
And I said, you don't tell me you're going to drink that. And he got down and he was drinking away. And I said, well, no wonder you guys are sick all the time. And that pretty well says it all.
Yeah.
Wherever you have human beings, they have to have water, but the quality of that water may not and frequently isn't very good.
Right. So you took that to heart, and you developed and distribute a remarkable water filtering system. You want to tell us about that?
You know, about 4 years ago, a group from Dallas came out on a mission into Mexico with us, and one of them, the gentleman, happened to own a company making ceramic filters. And he brought them with him, and I looked at him and I said, "What, Ron? This is the answer to getting clean water to everybody. They're cheap and they work. If water goes through the filter, you can drink it. Period. If it doesn't go through the filter, there's nothing to drink." So I said, "This is the answer." So Ron and I became extremely good friends. He at the time was working with the Texas Baptist Men on doing just disaster. He'd gotten a little bit tired of the corporate world. But I said, no, Ron, you got to get back to work. I said, we need to get this around the world and more. It's already in quite a few countries, but I said, we need to take this out basically into the retail world as well as the humanitarian and missionary world, and start building the company. And so over the last 4 years, that's what we've been doing. Yeah. And we now have these filters that just recently were certified here about 3 weeks ago by the FDA to remove not only cholera but viruses.
And that's extraordinary. Most filters do not do that, right?
Yeah, no. Most of the ceramic filters won't do that.
Yeah. And they're cheap. They cost about what you said, $20 compared to.
You're looking at about 20 on a retail side. You buy them by the thousands, such as in South Africa, we're moving about 10,000 filters a month to the Zulu Indians in the northern part of South Africa. And so when you buy them in 10,000 lots, you're getting in around $18, $19. Now these filters also I just this morning got off the phone with people in Chihuahua. They're looking to get their water project started. We're hoping it works that way, but they're working in mining areas where you run into arsenicals. And of course, there's more stories about that, but the bottom line is that the water, not only do you worry about the parasites, but you worry also about arsenic, arsenicals, which are kind of bad. And we can modify our filters to take those out.
Yeah.
So they're really an extremely good way to do this.
Now, the normal water filters, what you said, about $80, a lot of them $70, $80. So this is radically less expensive.
Yeah, the only true competitors that we have run around $80 or more, and so the cost of these are 25% of what's out there, and the way our systems have them, the various filters they have, they're considerably more flexible. I can take two brute barrels, put in 3 filters in it, and give you 700 gallons of potable water a day, and you can pour sewage in it, literally pour sewage in through these filters and drink it. So it's that good.
That's amazing. So this can have a huge impact on the health of people, and you have to educate them about the importance of using this water versus just going out of the stream, because it's not going to work if they're doing both, right? So there's an education process involved too, right?
Yeah, I met with the government of Acapulco. In fact, worked up a program showing them how they had to get the filters, one thing, but I said you've got to do the education. We worked up a system to really involve the community, as well as, of course, your schools and churches and all, as a community project to get clean drinking water to their people at a cost that they certainly should be able to afford.
Well, it's very exciting stuff, and a lot of incredible work over. And it seems like you're still going strong too after 40 years. So, well, thank you so much, Dr. Sherman, for being with us and sharing the exciting stories of what God is doing through the medical ministry, CHIA. And how has Dr. Sherman's story impacted you? Might God be calling you to help the underserved in some way? We'd love to hear from you on Facebook, Twitter, or our website at kscetv.com/decision point. Thank you so much for watching.